for our elected officials.
Mayor Ronnie Felder, Chairperson Julia Botel, Chair Pro Tem Douglas Lawson, Councilperson Troderick McCoy, Councilperson Kashamba Miller Anderson, Councilperson Shirley Lanier.
I'm here.
City Manager Jonathan Evans, City Clerk Claudine Anthony is present. City Attorney Don Wynn. That's all we have, Ms. Noel.
All right. Thank you, Ms. Anthony. Just to let everyone know, the city manager may be joining us a little later on the call to include a few other elected officials. But with that being said, we're going to go ahead and get starting with our teleconference. So again, my name is Marsh Noel, assistant to the city manager, and we welcome you to our regular community teleconference on COVID-19 and city operations. Before we get started, I like to always encourage our listeners to please share this conference call with others. We have quite a few bit of callers in tonight, a bit different than what we normally see, and so that's good. We like the engagement, so please let folks that you know, your neighbors, your family, know to join this call. If you're watching online, please share this recording as well. We want to make sure we spread the word as much as possible, because I truly believe you're going to gain a lot of great information, especially in light of everything that's going on. With that being said, just so you understand how tonight is going to go, we're going to start first with staff reports from members of our Emergency Operations Center. Afterwards, we're going to open up the floor for any questions, comments, or final remarks from any elected official that's on our call. With that being said, we're going to go ahead and get started with our Operations Section Chief, Chief Kurd.
Thank you, Ms. Noel. Good evening, Council, community. I will be reporting out in the operations section, and I will also be reporting out for Ms. Grimsley in Health and Human Services, who is busy making phone calls for individual second vaccinations, which is very important. So I wanted her to stay on task, and I will be covering for her. Some of the information that we're going to go over tonight obviously covers the current state of where we're at. Obviously, the big conversation to be had right now is vaccinations. And we're going to jump right into it. Currently, the U.S. has seen a total of 25.6 million cases of COVID-19 with 429,000 deaths. In Florida, there have been 1,676,171 total cases with 26,249 deaths. In Palm Beach County, we've seen a total of 103,862 total cases with 2,139 deaths. The daily positivity rate for the state of Florida yesterday was at 10.19%. Palm Beach County was at 9.13%. The totals, respectively, for the state of Florida is at 16%, and the total positivity rate for Palm Beach County is at 15%. These numbers are still way above the numbers we would like to see for contact tracing to be effective, but we're going to continue to preach everything that you've heard of social distancing or physical distancing, wearing your mask, hand sanitizing, zeroing in a little closer to our community. We have seen some good things out of our community through some of the contact tracing data, and I just received today the latest contact tracing data. In Palm Beach County as a whole, there are 52 areas that are deemed hotspots. Hotspots are areas where in the last week, 24 to 60 individuals have tested positive for COVID. Of those 52 hotspots, the city of Riviera Beach has one census tract area that's deemed a hotspot. That's census tract area 10.02, and that area is located west of 95, south of Blue Heron, on the southern half of the Military Trail corridor. Now, be mindful that that census tract area also extends out into Mangonia Park and West Palm Beach. So it's not all of what is Riviera Beach, but nevertheless, it is affecting our area. So that is an area we're going to be looking at clinicians, ensuring that they understand what's happening in their area and they're taking the appropriate precautions in that area. Other news on the virus front, they have identified 3 new variants of the virus. Those 3 new variants have been identified as being more contagious, not more deadly. So there are some areas in the United States that are being monitored for these new variants. We've seen it in Europe, over in the UK, in England, and inevitably we will see these variants here in the United States. And there are areas, again, that are being identified as areas where they're looking into this new variant. Basically, it being more contagious is at a dinner table of 10, instead of 1 or 2 people contracting COVID from an exposure, you could see anywhere between 5, 8, and even at times all 10 people at the table contracting COVID. So we're very concerned with these new variants. All the more reason for all of the things that we've been impressing upon our community with the hand sanitizing, the physical distancing, and also the enhanced cleaning, hand sanitizing, and also understanding if you're sick, please stay home. Self-isolation is still key when individuals are feeling ill. We have received some information, and we'll talk a little bit about the vaccination. I'm sure what most people have tuned in for. I did have a conversation with the Department of Emergency Management, and we were informed that as of February 6th, the Palm Beach County Health Department will no longer be receiving any more first doses. They will be transitioning into the second doses for the first dose administrations that began in late December through January. They now will focus their efforts on those second doses. There still will be first doses coming down from the state, but they will be doses that are for sites that are being run by the state. They will also be for the healthcare district who runs our hospitals and the Publix shopping centers that are now involved in the vaccination process, and we'll talk a little bit more about that. It is being recommended that anybody that is contacted and they are looking for appointments, for them to make those appointments online if possible. They have found that phone lines, call-ins are ineffective. The systems can't handle the inundation of phone calls that are coming in. So your best shot at getting a vaccine is registering online. If you do not have online access, please try to reach out to friends and family. Also remember there are other avenues for you to be able to do that. And we really urge that you look at those options for scheduling appointments when appointments become available. Understand we are in the beginning of the phase 1 vaccination, which includes frontline healthcare workers and persons over the age of 65. We have not yet moved into any other phases. There is no date, time that I can give you on when we will enter the next phase, opening up vaccinations to larger groups of individuals. That still has yet to be determined out of the governor's office. You may have heard rumors of individuals under the age of 65 getting the vaccination. Please remember that hospitals have discretion to vaccinate persons under the age of 65 based on their hospitalization, their stay at the hospital, and their pre-existing conditions. At closed pod sites and many of the open pod sites, there is no discretion. The governor's emergency order is very specific to individuals over the age of 65 and frontline healthcare workers. The state and the county are recommending that all inquiries for vaccines get directed to Publix, or you can always look at the Palm Beach County's website, discoverpbcgov.org. Again, the website is discoverpbcgov.org. You can go to COVID-19 updates. Under the COVID-19 updates, there is a vaccine section that has all of the information for the state-run sites, those managed by the healthcare district, and information on how to schedule yourself for a vaccination at any of the Publixes. There are 67 Publixes in Palm Beach County, Each one will be receiving 311 doses per store per week, totaling 20,837 vaccinations a week by Publix. Clearly, there is a concern in some areas. I know the Belle Glade, Pahokee area has some concerns where they have no Publixes. City of Riviera Beach has a concern that the Publix in our municipality does not have a pharmacy, but there is a Publix on US 1, Broadway Boulevard at North Lake, which is going to be our closest Publix. And I can assure you that our city manager, our elected officials are working with county, state representatives, and the governor's office to try to bring those vaccines into our area. And we have several things in place, but I would not yet count on that until the vaccine is in hand. These are simply discussions that we're having, and it looks promising to get the vaccine in and around our community. As far as the data as it relates to vaccinations, Palm Beach County actually leads the way in vaccinations of individuals 65 and older. 27% of 65 and older individuals have been vaccinated. However, that only makes up 8.7% of the population in Palm Beach County. Again, city and county leaders are working with the state in regards to bringing the vaccine into some of the different areas within and around our community, and we're going to keep working on that. As it relates to our community, according to the 2010 census tract data, Riviera Beach has approximately 33,000 residents. 16% of those residents are over the age of 65, which makes up approximately 5,300 residents. We are able to estimate with great certainty that we have vaccinated approximately 500 seniors in our community, making up 10%, estimated 10% of our seniors. So we are happy for that. While we still have a long way to go, we also have to work on messaging towards our seniors that the vaccination is important, the vaccine is safe, because while I want all 5,300 seniors vaccinated tomorrow, there are many seniors who are very apprehensive about receiving the vaccine. We've been out to some of our senior living centers, and we've had seniors that are just reluctant at this time to get the vaccine. So we must try to impress upon them that this is safe, it is important, and it is imperative, considering their age, that they look at obtaining this vaccine. In reporting out for the Health and Human Services, we are working with the Senator's Office and the State Department of Health and the Florida Department of Emergency Management to schedule 500 individuals for their second vaccine at Wells Recreation Center. Those calls are going on right now. We have also scheduled 40 seniors at Heron Estates for their second vaccine. And tomorrow we will be reaching out to the 120 exclusive Riviera residents that received the vaccine in Riviera Beach's closed pod to schedule their appointment for their second vaccination. Ms. Grimsley wanted me to report out from Health and Human Services that beginning in February, food distributions will go to a twice monthly distribution, which will occur every second and fourth Friday from 9 to 11. We are currently still serving up to 350 families weekly through Feeding South Florida. But due to the decreased demand and availability of food, we are going to have to stretch that to twice a month. So please make sure that the information gets out the second and fourth Friday, beginning in February. Food distributions will continue at Wells Recreation Center from 9 to 11. That concludes my operational report, and I turn it back over to you, Ms. Noel.
All right, thank you, Chief. Next, we're going to hear from our logistics section chief, Ms. Pimsel.
Good evening, everyone. This is Althea Pimsel. I'm the procurement director and also the logistics chief. Thank you so much, council and community, for coming on the call tonight. We are currently monitoring our logistics. We have an ample supply of surgical masks, KN95 masks. We have roughly about 2,000 of those and 72,000 surgical masks. Cloth masks, we have excess of 11,000, which we keep on hand to be able to support Chief Kurt and Mrs. Grimsley's operations as well. We also have an adequate supply of sanitizing wipes and aerosol sanitizer. We'll be replenishing and keeping in stock thermometers to be able to use throughout the city at the different departments and where public meetings occur. Also, we will continue to monitor our glove supply and to keep those stocked as well for elections and any other public meeting where the gloves are being required. Currently, I don't know if there's going to be a mass distribution again, but if there is, we are prepared to be able to support the community in that regard. And I want to reemphasize, as well as others will, the washing of hands, the using of hand sanitizer, and remaining socially distanced. I thank Chief and the City Manager for all the work they've done to protect the workers and the citizens. Thank you, and that concludes my logistics report.
Thank you, Ms. Simpson.
Ms. Noel, this is Chief Kurd. May I please add on to my report as I'm receiving information real time?
Yes, certainly.
One of the things we want to talk to the community about as well is the rumor mill. The media is putting a lot of information out there. As Ms. Grimsley has been reaching out to individuals in and around our community to schedule their second appointment, somehow a rumor has been created that individuals need to go to Publix for their second vaccine. That is inaccurate information. Please stay away from the rumor mill. We have been guaranteed by the Palm Beach County Health Department and the state of Florida that everybody's second vaccine is reserved, and you will get a phone call to schedule your appointment at the location in which you received your first vaccine to get your second vaccine. There is quite a bit of rumor about second doses. There's quite a bit of rumor about vaccines not being available. All I can go on is the information that's being provided, and please rest assured that we've been assured that your second vaccine is reserved and is available, and you will be receiving the second vaccine. You will also be receiving documentation of your vaccination. That information will also be uploaded to the state. We had issues during one of our vaccination setups where the state was inundated with entries. We've asked individuals, and as we're calling them, to please be patient as we get that information to the state. And anybody who received a vaccine from the city of Riviera Beach will receive a vaccination card at the time they receive their second vaccination. We were going to try to hand deliver each vaccination card, but the logistics of going to 120 homes, it was decided that you all will be coming back for your second dose. And at that point in time, we will ensure that you get your vaccination card and the records to prove that you have the vaccine. Please, please, please stay away from the news, the media. The news sources are unreliable. There's a lot of speculation that's out there. Facebook has a lot of misinformation that's out there. If there's anything of great importance that needs to be shared with our community, it will be shared on phone calls like this, Facebook, Channel 18, and our city's website. So thank you for helping us dispel any of these rumors, and please stay out of the rumor mill. It's not helping the situation. That concludes my update. Thank you, Ms. Noel.
Thank you again, Chief Kurd. Next, we're going to hear from our planning section chief, Mr. Bailey.
Good evening, council and residents. The planning section is working on three distinct projects as of right now. The first is evaluating scheduling software that'll streamline the onboarding process as more opportunities for vaccination distribution become available. We want to make this as quick, painless, and fair a process to get vaccinated through our community efforts as possible. Secondly, we are preparing a document package. As we know, the vaccinations will scale up very quickly here in the next 45 days. We're expecting and hopeful and prayerful for a significant increase in the capacity and opportunity to provide vaccines to you directly within our community. Thirdly, the planning section is evaluating additional city-owned, city-run facilities throughout the city to potentially increase our capacity for vaccination. Currently, we are using the Wells Recreation Center, but the city is in possession of multiple facilities and sites that may become needed and used in order to increase our capacity as we foresee the vaccine effort increasing again in the next 45 days. Those are the three major projects out of the planning department, and I turn the call back over to you, Ms. Noel.
All right, thank you, Mr. Bailey. Next, we're going to hear from our finance section chief, Mr. Sherman.
Good evening, everyone. This is Randy Sherman, City Finance Director. Thank you for joining us this evening. I've got three items that I would like to bring you up to date on. So let's start with what we're calling Phase 1, which was our initial response, which really started back in March and went obviously into the fall. We have submitted our paperwork to FEMA for reimbursement of our salaries. Total cost of that was approximately $1.4 million. Yesterday, we were kind of on a curveball from FEMA. They have declared that the event actually started back in January, which means that we now have to go back and that 60 days of information that we were not tracking. And they have also told us that we need to operate under our previous disaster pay policies that we use for hurricanes and not our pandemic pay policies. So we will be pulling all our data down from the FEMA website, reworking it with the different pay policies, and resubmitting it. Now, fortunately, our pandemic pay policy pretty much mirrored our disaster pay policy. So I don't think that it will be that difficult to resubmit, but that is a requirement that FEMA has asked from us. Also, give you an update on the county money. Recall the county received approximately about $260 million from the CARES Act passed by the federal government. Initially, the county had intended to retain all those funds and use them for county services. Back in November, they actually opened up the opportunity for communities to get reimbursed for out-of-pocket costs, not salaries and benefits, but supplies and equipment. The city submitted a request for $512,000. To date, we have received approval of $317,000, and we're still waiting final approval on the balance, which is about $195,000. We've supplied additional documentation on that $195,000, and we expect to get not only final confirmation in the month of February, but also the actual reimbursement. And then finally, as you've heard, we're now kind of in Phase 2, which is the vaccination process. I do want to let everyone know that the City Council has approved $250,000 toward that vaccination process. So I just want everybody to know that should the city receive vaccines that we can dispense, we certainly have the financial resources, to meet that demand should it arise. And that ends the finance report. Back to you, Ms. Noel.
All right, thank you, Mr. Sherman. Next is going to be a communications report, which I will provide. So in case anyone's not aware of this, but the city has a new emergency alert system called Code Red. And this is going to be very important for us because amid all that's going on, especially with all the various activities associated with COVID-19, we highly encourage every member of our community, whether you're a business owner, a resident, or what have you, that you please go and sign up to be registered into the system. It is going to be our primary method to efficiently and effectively communicate with everybody about what is going on and how you can be in the know, especially as it relates to resources like vaccinations and things of that sort. So if you are interested in signing up, I'm going to lay out 3 ways in which you can do that right now. So if you need to go ahead and grab a pen or a pencil, go ahead and do that at this moment. The first way in which you can sign up for Code Red is going to be our text to enroll method. You can simply text the word RB Alert with an S to 99411 to register by mobile phone. Or you can register online by going to rivierabeach.org/Code Red. Lastly, you can register by phone. You can simply call 866-939-0911 and select option 2. That line is open for support Monday to Friday from 8 a.m. to 6 p.m. Again, this is going to be our primary method of disseminating information in real time on any major incident, COVID-19, and so forth. So please make sure to register. From what I understand earlier today, we've had 400 residents sign up, 20 businesses. We're hoping to increase that number on a day-to-day basis. So if you have not yet signed up, please go ahead and do so. In addition, we are utilizing this as a primary method of communication for city employees as well. And they've also been informed to register into Code Red. With that being said, that completes my communications report. Last but not least, we're going to hear final remarks from our city manager, Jonathan Evans.
Thank you, Ms. Noel, and thank you, council members, for your continued support as we've almost been at this for a year now. Obviously, we've heard with regards to the vaccine, and that is the thing that's on the minds of most residents in our community. We are fighting feverishly to obtain a distribution of the vaccine. With Publix entering the sphere, it has provided for significant challenges as it relates to the access for the vaccine. However, based on all the information that we've been able to research, is that the vaccine has not been distributed fairly and equitably throughout Palm Beach County as it relates to communities of color. And so one of the things that we're looking to work with our state representative, Bobby Powell, our county commissioner, Mac Bernard, and the county administrator, Virginia Baker, is to how we can look to see another opportunity in the city of Riviera Beach for the distribution of the vaccine. As early as today, I did have a conversation with those individuals, and they are advocating on every front possible to attempt to obtain additional vaccines for our community. If we are successful in obtaining vaccines, we will roll it out as quickly and as swiftly as possible and make sure that it gets into the arms of those persons that are eligible to receive the vaccine. Those are individuals over the age of 65. We have also, like was stated earlier by Mr. Sherman, have asked the elected officials for an appropriation to facilitate the spinning up of a vaccination distribution pod. And so we do have the money on hand ready in the event that we're able to obtain the vaccine and get it out to our community. So your city has probably distributed as much vaccine as any other municipality. The only municipality that I think may have distributed more vaccines than the city of Riviera Beach is the town of Palm Beach. And they actually received the first allotment, and that was a controversial matter which has been discussed numerous times in the press. I cannot emphasize the importance with regards to making sure that you sign up for every notification site or tool that the city has to disseminate the information. It is important that you are following reputable city sources for information related to the vaccine and when the vaccine is available. We know that the Publix in our community does not have a pharmacy, so in essence, it has provided a situation where there's a donut hole in our community. We have known since the early onset of this pandemic that in order to get the vaccine to communities such as ours, it would require a alternative approach. Most municipalities that have done this completely online. Publix themselves has deployed the strategy for the dissemination of the appointment times online. We have propped up a call center. We call individuals and give that personal touch. And actually, in my conversations with the county administrator, that is going to be the process that the county looks to deploy when they are operating pods throughout Palm Beach County. And that was associated with the activities that your city was on the forefront of moving forward. Additionally, we've seen, even with the mask distribution, we were the first community to disseminate masks via the mail, and the county followed suit with the distribution of probably well over 3 million masks at this particular point, because they have still continued the mass distribution via the mail systems. So again, we've been on the cutting edge, and that is a testament to the elected leadership and the staff that we have that have been locked into this since the onset of the pandemic. And so we are going to continue to make sure we address some of the areas of concern in our community. I believe the chief has spoken that we do have some hot spots. We have one specific hot spot in our community, and so we're going to look at some targeted communications and even maybe targeted mass distributions in that particular area of our community, and encouraging folks to wash their hands, physical distancing, as well as making sure you're utilizing hand sanitizers and wearing your mask. We cannot emphasize the importance of wearing your mask, and even some of the information that you're hearing from healthcare professionals is 2 masks are better than 1. And so you've seen that information even come out from the Biden administration about encouraging folks to have that extra layer of protection. So in the abundance of caution, it's not a bad thing to have an extra mask. And we just have to make sure that we continue to inform and educate our community about the impact of COVID-19. There's different strains that are out there now that are far more contagious, not as deadly from at least the original accounts. But this thing is going to be with us for a very long time, and it's going to be something that ends up becoming similar to influenza A and influenza B. It just becomes something that we can anticipate. And so we still have to continue to be vigilant. We still have to continue to keep this on the forefront. As it relates to some of the things that we're doing in the organization, we have continued the modified working schedule and making sure that persons are separated as much as possible. And when we do have a situation where there is a potential exposure, we are handling that as swiftly and as quickly as possible, making sure that persons are tested, as well as provided the services necessary to make sure that they return back to work and are prepared to continue to provide service to the agency. One of the biggest challenges we're seeing, and I think every employer is seeing, is that individuals routinely do not catch COVID at work. They are doing things that are high probability and present a significant risk. And so continuing to let folks know that when you do go out, when you're doing things, when you're seeing family and you're not adhering to all the things that we've communicated since the onset of the pandemic, you are putting yourself in a significant place of risk. And so we are continuing to educate and inform persons to be careful. You also know that there is multiple testing that's available, and we're encouraging our community, if you want, you're going to see the rapid antigen test, and folks are utilizing that as a mechanism to determine if they're COVID positive or negative. That is not the most accurate test. The PCR test is the most accurate test and is the gold standard. So in the abundance of caution, if you do take an antigen test, it is always better to follow up with a PCR test or start off with a PCR test, because that is the gold standard as it relates to testing. And we're going to continue to look to provide testing to our community. The frequency of that may change because we're looking to be able to prop up our operations operations to be able to provide the vaccine as quickly and as swiftly as possible. So again, to the elected officials and the community, thank you so much for continuing to listen in on these calls. We will continue to provide all the information that's available to us, and as soon as information is provided, we will disseminate it accordingly. And at this time, Ms. Noah, that concludes my remarks, and we will be open for any questions that the board may have.
Thank you, Mr. Evans. And so to your point, if we have any elected official on this call that would like to ask a question, please go ahead and do so.
Hello, can you guys hear me?
Yes, Ms. Lanier?
Yes, this is Councilwoman Lanier. I wanted to ask one of the questions I wanted to pose to the staff. And to, first of all, let me thank the City of Riviera Beach and the staff, especially Chief Hurd, the City Manager Jonathan Evans, Ms. Valerie Grimsley, for being able to provide us with information that it was engrossing from the very beginning in terms of the information that we've received. Saying that, I know that Mr. Bailey said that in the next 45 days we will be ramping up some of the vaccine sites to be able to make sure that people get the vaccine. One of my questions is, I know that right now the governor has said that the vaccines are for 65 and older. When do you think, or what is the word on the street in terms of vaccines for everybody else?
Chief Hurd, if you can handle that particular question, because I know you're talking on the emergency management call weekly with your peers.
Yes, absolutely, Mr. Evans and Councilwoman Lanier. What we've been given from the state of Florida is there will be a 3-phase approach. Phase 1, clearly we're in, 65 and older, frontline healthcare workers. The breakdown that was given to us is by March or April, they will be opening it up to phase 2. We don't yet know what phase 2 looks like. Will that then be 55 and older? Will it include teachers? Will it include bus drivers? So we don't know what it looks like, but we've seen a chart that phase 1 should wrap up in March or April, and then we should go into phase 2, and in the June, July, maybe into August, depending on manufacturing of the vaccine, it would then become available to the general public. We were told it'll be at least 6 months before it's available to the general public, and it'll probably take well over a year before the vaccine is available to everybody who wants the vaccine. So those are tentative dates, and what phase 2 looks like is yet still hasn't been determined by the governor's office.
Okay, that's for me. I mean, my parents, they're good, but for me, I was just concerned about people who are under the age of 65 and how that would play out. The second question is, you gave me some parameters in regards to where the hot spots were in Riviera Beach. I'm not sure of where. So there were 52 hot spots in the county, and there was a couple of them that were in the city of Riviera Beach. Tell me exactly where these hot spots are, and give me a landmark so I can know exactly what we're talking about.
Yes, ma'am. There are 52 in the county. There is one in Riviera Beach. Now, mind you, this information changes weekly. We had none last week. The one we have this week is west of 95, south of Blue Heron. So if you're on Military Trail and you think about Lone Pine, Indian Trace, that area over by the Rapids Water Park, but also moving south into Mangonia Park all the way down to 45th Street is where that census tract area lies. Does that help you out?
Yes, it gives me an exact location of where it is. I'd like to say again, thank you guys so much for the hard work that you're doing. Every council meeting there is a plethora of information and things that we have to do, but I am so happy that the staff and the city of Riviera Beach is putting priority for the vaccine and keeping the residents safe. I really appreciate it. And those are my comments.
Thank you, Councilperson Lanier. I don't believe there's any other elected official on this call. So before we do end it, there are just a few more announcements I would like to share for everyone. First, just so everyone's aware, this Sunday, January 31st at 11:59 p.m., our Citizens Leadership Academy application will close. So that means there's just a few more days for you to apply. The Citizens Leadership Academy is a great opportunity for community stakeholders, just business owners, residents, and so forth, to really engage with the city, learn about how it is that we operate, how it is that we serve the community, and ways in which you can better engage with us so that we can work together to solve a lot of the issues and challenges that we find ourselves in. In addition, we have the 2021 municipal election coming up this March 9th, so make sure to mark your calendar. It'll be an opportunity for our residents to vote on very important matters. We do have our District 4 seat that is open, and so we have 2 candidates running for that, so be aware of that. And then in addition, we do have proposed charter amendments that will also be on the ballot. There has been various communications being sent out on this. You can find it on our website. Simply go to rivierabeach.org/vote. In addition, we do have letters that will be going through the mail with more information as well for you to look over. In addition, we will be planning on community meetings so that if there are any questions, concerns, or thoughts that you would like to share with us, you'll have an opportunity to do that. So just look out for those communications by staying connected to our social media, our website, and our electronic newsletter. With that being said, that completes the rest of our reports this evening. Thanks again for joining us. Our next community teleconference call will be 2 weeks from now, same time, same place. So we hope to see you soon. Have a great night.